Good morning. Good morning. Good morning. Good morning, everybody. Wow. Okay, I'm live. Now you got it. You got it right. Good morning, everyone. Welcome to my little 15-minute quick burb trip tip, whatever you call it. Hi, guys. It's been a second. Why does it always feel like it's been an eternity when I've not been here? I hope everybody has started the week in the most fantastic way and is ready for November. And for me, November means December, which means January. It's like, okay, the year is almost over. That's where my mind goes. So it is quite, I don't know, almost an exciting thing. Although I realize many folks are a little challenged right now. But if you are alive, you know what? There is hope. So just keep fighting for what is yours. Okay? Just keep fighting for your dream. Just keep fighting for your purpose. Keep working at it. But good morning, everybody. This is Rachel from the MPH Life out here in Jacksonville. We offer health coaching, which really focuses more on education, advocacy when it comes to a lot of the lifestyle illnesses and really understanding what's going on with your health. If you leave your doctor's office confused about how to go about things and need some guidance on how to manage some condition and even control them, we are the folks to reach out to. We offer those virtually, so really anywhere in the US, okay? And of course, the senior care management here in Jacksonville and surrounding areas. This is for a lot of our seniors and the family really struggling to navigate this health care, okay? The health care with chronic diseases and conditions paired together, it becomes complex, especially if you are not medical or are very absorbed with your own life as the adult of a senior. So that's a little bit about us, okay? But today I come to talk a little bit about gastroparesis. Yes. Um, Oftentimes, when you hear about gastroparesis, you think diabetes. Um, Indeed, gastroparesis is a manifestation that will occur a lot with diabetic folks. But really, anybody can have gastroparesis. Anybody can deal with gastroparesis. Let me put it that way. So there is the diabetic gastroparesis, and there's gastroparesis. Okay, what is gastroparesis? Really, the definition of the word itself is gastroparesis from paralysis. That means the sluggish, I call it lazy emptying of your digestive system. That's basically what it is. One of the big manifestations of that thing is constipation. Okay. So with gastroparesis, normally your intestine really move. When you eat, your stomach in your stomach get digested, gets moved in the intestines, the small one, and the small intestine, which we have several feet of in our body, really moves that food along, and it's during all of that process that nutrients are being absorbed in the body. The things we need are being absorbed through that process. What happens with gastroparesis is typically the food first is taking forever to get out of your stomach and move down, and then when it does get in the intestines, it is extremely slow. Typically, when we eat any food within 2 hours, half of our food should be in our small intestine, which we call small bowel. It should start getting there. And about 4 hours in, 90% of that food is in there moving along. Okay. And with gastroparesis, that is not happening. It's taking way much longer. So, some of the symptoms of gastroparesis are, of course, constipation, bloating, nausea, vomiting. Some folks will have diarrhea, You have lack of appetite, you have severe acid reflux, and you eat just a little bit and you feel full. You eat just a little bit and you feel full. So um, that is a symptom many people deal with, and they don't necessarily realize what they are dealing with. And so if this is something you are dealing with, you need to bring it up to your doctor's attention. What causes gastroparesis? Well, the exact cause of it is really not known or explained. However, it is often tied to side effect of medications. It is tied to previous belly abdominal surgery. It is tied to some health conditions such as diabetes. It is also tied to, I'm trying to think of, I talk about medication, opioids being a big one of them. Okay. Um, it is also tied to, nervous system conditions. So those that are dealing with Parkinson's and things like that of the nature, this is when you will see some manifestation of gastroparesis likely. So it is pointing to the fact that, it may have to do with your nervous system and the signal it is sending ultimately to your digestive system, as well as the things you are eating that may really be interfering with that, or even the ability of your intestine to be moving things along. If it is relaxed, if it doesn't have any tone, it becomes difficult. But they all are kind of tied together, because if your nervous system is not sending the signal, your intestine is not working, it loses its tone over time. So you get the idea. So those are the manifestation of gastroparesis. And somebody will say, well, I'm constipated, what's the big deal? If your symptom is only some mild constipation and you can get things going, then that's good. But the severe cases of gastroparesis, these are folks that will eat and the food will barely get digested, and sometimes it will get stuck in the bowel, get stuck and get hardened, and then lead to infection. Sometimes you see people with small bowel obstruction and things like that. This can get you in that position. The other thing is, because things are not really getting digested properly, you are having issues with absorption of those nutrients. So folks will suffer from malnourishment or malnutrition in a sense, dehydration, that type of thing. So the severe cases really are not fun. This is why you want to be proactive, especially if you have been diagnosed. There are medications to help along, but try to do things yourself to help your digestive system, and I will give those suggestions. So, by the way, if you are watching with, oops, I almost canceled the video. So if you are watching wave and tell me where you are watching from. If you are watching this afterwards on YouTube or on my page, if you have any question, post them, okay? I start these videos with my group for them to have access first, and then I'll post it later on the other platforms. So that's that. So yeah, gastroparesis, like I say, you can have severe dehydration, malnutrition, the food that gets hard in your stomach, and for diabetics specifically, this really interferes with your blood sugar level. If you have figured out this system to get your blood sugar control, especially if you're on medication and you've been doing, what to eat, how it affects you, and you've been doing the right thing, and your sugar level has been consistent, and now you are having struggle doing it, and you are dealing with gastroparesis, that may be one of the reasons why. Because remember, digestion rate has been interfered with, therefore the release of the sugar in your bloodstream is being interfered with. So it kind of puts everything, it makes it harder for folks to control their blood sugar, because now it becomes unpredictable. You don't know when the intestine is really going to move things along, or the stomach is, and you cannot control or predict that. So it makes it a little harder for the diabetics. Okay, so this is when again doing things that help along will help you. And of course there are medications for that, and make sure you talk to your doctor. If you are going days without having a bowel movement, make sure you talk to your doctor. If you are abusing of laxatives, understand that it only makes matter worse. Your bowel learns to be lazier and lazier because it's depending on those laxatives now. So be careful with that, okay? Excuse me. It's been So, yeah, be careful with that. Do not abuse of laxatives. There are folks that don't think about it and they feel they need to constantly take laxative to go. Unless it's been established that you are at the point where this is all you can do to move your bowels along. There are still other alternatives really to help that entity move things, unless you have some condition, in which case we cannot prescribe those things. However, if you are a good candidate, there are other things that could be prescribed to you if needed. And of course, again, doing your own lifestyle changes, which I'm big on, even before medication to help. So you are like, okay, Rachel, you've been talking for a minute. What do I do? What can I do to help this? I'm glad you asked. I'm stalling. I'm kidding. Yeah. What can you do? First, learn to eat small meals. Learn to eat small meals. When you overload your tummy, it makes it even harder to get things moving along. So learn to eat small meals. The other thing is your eating should be rich in fiber, because fiber is one of the things that really help with that motility business. So you ought to intake a lot of fiber, or intake sufficient amount of fiber in your diet. The other thing is exercise. Yep, exercise helps a lot with these things. So even things such as walking will help you. Simple walking will help you. I talked about eating small meals. One thing you want to do is learn to chew your food well. At this point, you don't want to be, inhaling chunks and things when your bowel is kind of slow. You were given tip for a reason. Chew your food well before you swallow it. I talked about fiber and positioning, like those that like to go to bed right after they eat. It doesn't help. Okay, give at least, that's the very, very, very minimum. Give yourself at least 2 hours after you eat before you go lay down. Okay? Do not, and if you, like, some people eat laying down, I don't know, eat in bed, that's I'm having a hard time. That is something as almost common in the hospital, but there are some people, if you are in bed, like bed bound, sometimes they will be doing that. So it doesn't help. You want to sit upright. You want to sit upright. And the one thing I want to also say is hydration. You want to keep up with your hydration. To help the digestion system. And last is the amount of fat you eat. Watch how much fat, the fried food, the that type of things make it harder for your system to move things along too. So this is when you really want to start eating more nutritious food as opposed to junk food. Yeah. So that's my tip today. I did not talk about some of the risk factor besides diabetes, but in this particular for this particular talk, there is, well, I talked about diabetes, I talked about having nervous system conditions. So previous surgery I actually did. So um I cover most of what many will want to know about gastroparesis. So this is just to tell you, hey, this is what it is, this is what you are dealing with, and you should do things about it, to really be proactive and keep it from getting worse. Okay. You take good care of yourself, you listen to your body, and I thank you guys for watching this. Make sure you share if you like these videos. That is very helpful to me. All right, guys, you have a good rest of this Monday. Beautiful, amazing Monday. We are in Florida. It's sunny and gorgeous, and I hope many are sharing this today. Um, Bye, and I will see you again next time.